My name is Amy Lee, and as you can see, I'm on an airplane going to Denver. So thank you so much for allowing me to join you in this way. I am currently a program director for the Consortium of Eastern Ohio Master of Public Health Program and professor at Northeast Ohio Medical University. I've been a member of the Ohio Public Health Association since 1993, and that was before I became a member of APHA. I have been OPHA's president, webmaster, and academic section chair. Since 1999, I have been and still am on their annual planning committee for their conference. As program director for the MPH program, I value my membership so much that we pay for OPHA student memberships for our first year students who register. I've been an ex officio member of APHA's executive board, so I know the responsibilities. I am also current president for Asian Services in Action, which is a social service agency and federally qualified health center. So I'm familiar with reading financial statements and making decisions with other board members. I love being a member of the Ohio Public Health Association, and here are my 3 talking points to get you to join us as a member. First, you can learn about emerging public health issues on a local level. The Ohio Public Health Association partners with other state agencies to provide an annual conference and professional development trainings that you will find engaging. 2 is that you can impact public health on a local level. The Ohio Public Health Association can help by giving you tools to help you advocate for public health issues in Ohio and can connect you to collaborators. 3, and most of all, you can expand your public health network. I am a 28-year member of the Ohio Public Health Association because I have so many colleagues in public health who care about building community resilience, who have advocated for better health, and the best part, hired our MPH graduates. Some of our graduates participated in conference planning, and one graduate still helps in their communications. And personally, I've had the opportunity for leadership positions as president, webmaster, and academic section chair. I've also helped advance the academic research of our faculty and students in conferences, such as the one behind me. It's one of 2 rooms that students are presenting and interacting with our public health practitioners. I've also gotten to collaborate with other associations, such as the Association of Ohio Health Commissioners and Ohio Society for Public Health Educators, and I've been able to participate in forums with Ohio Department of Health Leadership. OPHA offers so many doors, and all I have to do is open and walk through. And all you need to do is join us as an Ohio Public Health Association member. As president of the Board for Asian Services in Action, also called ASIA, we were one of the organizations at the center of attention when in March of this year, 8 people were shot and killed in Atlanta. 6 were of Asian descent. Our communities were suddenly in fear for ourselves and our families. When I represented ASIA for a Diversity on Board nonprofit agency forum, a subgroup of Black African American members offered a statement of solidarity against hate, and they prepared it especially for me. First, APHA can expand awareness and education that racism is a public health crisis to the public through social media and other communication channels and their networks with other associations and key partners. Some people are not aware that racism is an issue affecting health in our lives, and some people even deny that racism exists. Second, APHA can be the premier organization for championing health and equity in all policies. APHA already advocates at the federal level and has a number of statements, experts, and tools at their disposal. Third, and most of all, APHA can provide the tools to us that they use for federal advocacy and education to the public to advance this agenda that there should be health and equity in all policies through our networks, affiliates, sections, student assembly, special primary interest groups, forums, and caucuses. Changing public sentiment is difficult. I believe the answer is solidarity in our efforts. With APHA's 25,000 public health professional members, we can perhaps start changing the attitudes of our legislators, coworkers, and neighbors. With APHA, we can do this together.